Okie dokers. All right, I'm going to go ahead and get started. Let those West Coast folks just wander in as they will. Hey, everybody, my name's Clay. Welcome. We're honored to have y'all here tonight. We appreciate you taking some time away from whatever it is you're doing, whether you just wrapped up the clinical day or you're halfway through your East Coast evening with us. We appreciate you being here, so thank you. Just some quick housekeeping. If you didn't hear me say earlier, poke around in the Zoom app and find the chat. In said chat, if you would drop in your name and where you practice, and that'll help us make double, quadruple sure that we get the email out to you and that we mark you as attended so you can get your CE and emails afterward. Groovy tunes. With that said, kind of focusing on like why we're here. Again, you're taking your time out. Hopefully this is of genuine interest to you. Some of you, I think I recognize some of the names from either Dr. Sayre's time on like the compendium, some speaking events elsewhere, maybe even some other webinars we do, perhaps the Joy ones. So if you kind of had a couple touch points with us and kind of know what this is all about, it's all about IV sedation, unlocking the power of, showing what it can do for doctors, their teams, their patients, etc. So if that's the room you wandered into, great, you're in the right spot. If that's not the room you wandered into, that's what we're doing tonight. And really what we're going to be doing tonight, which is a little bit different from previous webinars, is got Dr. Sayre here. You kind of learn more what his history is in just a second, but he's here to kind of help us pull back the curtain on someone who's really, really using IV sedation, putting it at the core of their practice. And what's that like? Talk to me about clinical, talk to me about safety, talk to me about meds, talk to me about team, talk to me about financials. It's a little bit of a moment to pull back the curtain and say, what's it like? So that's what we're going to get from Dr. Sayre, and Joy's going to be our MC. And that's it. Again, if you got any questions, pop it in the chat. We'll make sure those get to Dr. Sayre and Joy by the end. Groovy? All right. So let's get on to official introductions. So our MC, as I mentioned, is the amazing, the one and only, the illustrious Joy Santoro, 25 years in dentistry, and she's ended up here with us as the president of Vesper Institute, and is just an amazing wealth of dental knowledge and wisdom, and we're so lucky to have you. And she's going to be your MC tonight, and she'll be asking questions to this lovely gentleman, Dr. Scott E. Sayre, DDS, MBA, MAS, founder of Advanced Dentistry, as well as founder of Vesper Institute. And you kind of hear his story and what he's all about. As a quick overview of why you should listen to this fella, here's just in the professional world, not the other stuff. It's a pretty impressive dude, but I won't blow his head up. That's not my job. So quick overview, over 45 years in practice. That building right there is the mothership of all the practices. There's 4 offices, all of which are pretty dang large, pretty dang productive. A team of about 140 folks and growing that houses the whole operation, from clinical and hygiene to front office and billing and marketing and HR, the whole enchilada. Really happy, really motivated, really well orchestrated, cohesive team. It's kind of a lovely thing to behold. The 12 doctors currently in the advanced dentistry practice, all of whom, again, just like Dr. Sayre, kind of hold IV sedation as the center of the practice. It's kind of at the core of what they do. Everybody's ACLS. Everybody's kind of really all about this. So Dr. Sayre's perspective on how to run a very, very well-respected, very successful IV sedation center practice is pretty groovy. So we're going to kind of get into that a little bit tonight. And I think that's all we've got in the way of introduction. So with that said, 7 FAQs, the Super GP. Let's go. Take it away.
All right. Thank you, Clay. So we are so excited to be here. We are thrilled to talk about the Vesper Institute. We're thrilled to talk about Dr. Sayre and what he does in his practices. But the one thing that has come across to me, especially, is I get to talk to dentists all over the country. And all day, every day, I have dentists reaching out to me, asking me questions that really need to go to Dr. Sayre because they're asking things about like, well, how did he figure this out? How does it all work? So we're going to dive into 7 FAQs with a super GP, Dr. Sayre, and these are really questions that I get all the time. So Clay, let's jump in. All right, so we've heard that Dr. Sayre has this amazing, beautiful practice in Ohio. He's got 4 practices, lots of associates, lots of parts moving all the time. So Dr. Sayre, the big question that I have to ask, you've been doing and practicing dentistry for over 40 years. My question to you tonight is, why, as a GP, are you practicing IV sedation?
Well, good evening, everybody. You know, I think that you're seeing on the screen a few things, but I realized many years ago that I wasn't happy doing dentistry and creating pain for all of my patients and not being able to do as much dentistry as I could. I went through a residency that taught me sedation. I have the number 15 certificate for sedation in the state of Ohio. So I did this before even the instructors and everybody else wanted to get those certificates. And, you know, if patients aren't comfortable, they're not going to come back. We don't understand that as dentists because we don't get to see almost 50% of your potential patients aren't coming in. 36%, this is in the literature, 36% of the people out there are fearful of the dentist. Almost 20% are just not going to come in until they have to go in, go to sleep, go to the oral surgeon, or go to the hospital. It's that simple. Now, on top of that, what about the most productive types of general dentistry, from implants to extractions to sinus lifts to wisdom teeth to whatever you particularly want to do. More complicated cases, full mouth rehabs, endodontics, several hours of appointments. Those people don't want to be there. So we need to make this affordable and comfortable for our patients. You go to the physician, you have a carpal tunnel done. It's a 6-minute soft tissue procedure and everybody gets sedated. So it's crazy that we don't take care of our dental patients that want to be sedated. I'm kind of an introvert. I might be sitting here talking to you, but at the same time, I don't want to discuss family life, my dog, my vacations, my other things with patients. I'm just not that kind of person. So as it says, less psychiatry and more dentistry. I can do a lot when they're asleep. I can't do much when I'm talking to them about, hey, you'll be okay. It's okay. Don't worry about it. And my staff doing the same thing. And the financial part of it. So happier patients, happier staff, happier me, financial freedom, all of these things are really what sedation is about.
And Dr. Sayre, I love how you always bring it back to your patients, right? It's about them being more comfortable, and ultimately you and your staff are more comfortable. So it creates such a nice environment in your practice, and you really feel that when someone comes in. It's such a warm, inviting environment because of that. And I love that, I love the happiness factor. I think that unfortunately I talk to a lot of dentists that are really just sort of burnt out. They're at the point where they say, can dentistry get any better? And so you implementing IV sedation really has put that happiness back into dentistry. So I love that answer for you.
Joy, let me just say one thing.
Sure.
Dentistry is a very difficult profession.
Yes.
In medicine, the surgeons don't have to put up with people that are awake. They just don't. So when you're doing these procedures and you have some way to make people happy while you're doing the procedure, that's the key point.
Yeah, absolutely. All right, question number 2. So I have heard you say this numerous times, Dr. Sayre, that sedation exists on a continuum. So I'm going to ask you to explain it. I'm going to ask if you could explain also what level of sedation you practice. And then the one question I don't have on here, but I do get quite often is there are people, perhaps even on this call tonight, who practice oral or PO sedation in their practice. Can you also explain where that fits on the continuum and what the difference is between how you practice in your office every day?
Yeah, sure. So we do have a continuum here. This is a very shortened version of it. We call it iatrosedation. That's where, and this is taken from Malamed's book. So iatrosedation is soft music, nice chairs, upholstery, your patients being talked to, how to tell them that everything will be okay, those kinds of things. And it works to some degree. And then you've got hypnosis, and you've got nitrous oxide, and then you've got local anesthetic. And then you have basically pill sedation, oral sedation, which the difficulty there, and there's tons in the literature, there's many, many lawsuits pertaining to oral sedation, because when you give somebody a pill, they take it, it goes into their stomach, goes in their gut, and then from there, it goes into the veins and arteries into the liver. So for the most part, it is a metabolite that is creating the sedation, and you don't know when or how long or for what degree, and it's not the same for everyone. So it's just difficult. And you can have patients that come in, they take a pill, and they come in and look at you, go, doc, nothing's happening, so I don't even want to be here. And they're supposed to be perfectly okay. Whereas moderate conscious sedation, IV sedation, is titratable. We give medications through the vein. It goes 25 seconds to the brain, and they get first pass equivalents of this medication. And so these patients are comfortable. We titrate to the needs of them. These are hypnotic sedatives, so they don't remember anything. It's just a wonderful way to practice. And it's right below, obviously, our general anesthesia and those kinds of things where they need to be intubated. And this is what you're going to learn. I can give a patient the medication, and let's say I do a difficult extraction, and they feel the pressure, and they're kind of like, oh, I give them a pinch of Versed after that. They will not remember anything. So this is just a wonderful way to practice. Your patients think they've had general anesthesia. They have not. It's safe. Everything we do is reversible. You can turn the nitrous oxide off. You can reverse Versed. You can reverse any narcotic. And within a very short period of time, your patients are looking at you going like, what? So the safety of this is really far above any of the things even to the left on that chart as I'm looking at it, because this is something we totally control.
Okay. So, Dr. Sayre, I have heard you use the term procedural amnesia often. And so if there is someone on this call or is using oral sedation in their practice, the patient no longer has that. Is that correct? Like they will remember the whole procedure. They're going to remember the drilling. They're going to remember the whole experience.
This is patient specific. I can tell you that my dad took a halcyon to go on a long flight to Europe or Asia many, many, many years ago. He's not with us anymore, but he took one halcyon. He didn't remember the last 12 hours. Now, he was probably sleeping that time.
Right.
We have to understand the difference between sleep and unconscious, and you're taught those things in the course. However, it is patient specific. Older patients are going to be probably better on minimal sedation, and younger patients or people who are taking other medications are just, it's not workable, and they will have every experience will be right in their forefront. As a matter of fact, when you give any kind of very light sedation, meaning one pill or whatever, you can have the patient more alert, they can remember more, and it can be more of a problem because it's just like having a glass of wine. Everybody knows this, who's probably on this call. You have a glass of wine, you feel like, whoa, wow, I'm great, I'm awake, I'm talking, I'm this. You have 3 more glasses of wine and you're right. So that's kind of the titratable part of this. You can't do that with pills.
Right, right. Okay, great. All right, Clay, I think we're ready for our next question. So I'm going to set this up to everybody on the call to tell you, elephant in the room, if there is anything that I get asked every single day, it's about safety. Do we teach safety at Vesper Institute? How do we teach safety at Vesper Institute? And so one of the questions that I wanted to talk to Dr. Sayre about tonight is, he has this amazing, well-oiled machine when you come into his practice. I've been going to dental practices my entire career. I have never seen a dental practice work as well as Dr. Sayre's practice does. That's why I'm here. But the one thing about Dr. Sayre's practice is there is this amazing workflow of the staff that really incorporates this whole treatment of the patient, this idea of treating the patient, making them comfortable. And so, Dr. Sayre, I want to sort of understand for the people that are listening, what is your staff doing? How many staff are in the room with you? And then what are you as the dentist doing? Because I think that's a question that we get, because I have to sort of wrap our heads around the fact that, okay, well, if the patient's asleep, so what's the staff doing? And am I just doing the dental work? How does all of that sort of play out in your practice?
Well, Joy, that's a really big question. And I think it's really important for everybody to understand here that you do not do this alone. So if you don't have your staff trained, then you're basically in trouble. This is a staff-centered situation, and they're going to be the ones who are monitoring the patients and are trained to monitor the patient so that you can do your dentistry. And this is very, very important. So we have at least one extra staff member in the operatory during any case that we're doing sedation. That person is handling the monitoring sheets. They're handling and helping with the airway. They're observing the patient's form of sedation. They're watching the EKG, the ECG, the blood pressure, all those things. And so you have to have an extra person in the room. Many states require this, but many states don't say it in their documentation. I think it's totally wrong.
Yeah.
We have to be safe. And so we will train that you have another person in the operatory, that the doc by themselves is not the one just watching all the monitors and the patient. This is really, really important, really important. And as you train your staff and you get them ready to do this, they're so helpful because they're making sure that the patients are ready, that the medical history is composed and ready to go, and the patients are in good shape to do this, that they haven't had anything to eat, that you just have to come and see what we're doing and make sure. These things are just not trained in the docs program and the other programs. If they are, you just are told about it.
Right.
We want you to learn about it. We want you to be able to implement sedation in your practice. We're going to try and handhold you as far as we can, and then give you support after that.
Yeah.
And the dentistry is pretty simple. Everybody in this call knows how to do the dentistry. Okay, but it's the sedation, the monitoring, the safety, what your staff does, and their roles that is really important.
And that teamwork that you have, all working together for the safety and the comfortability of that patient, really puts it all together. And it's amazing to watch. It really is. So, Clay, I think I have another safety question coming up. I do. Okay, so we have a good sense of what the operatory looks like. We have a sense of who's doing what in the operatory. I get the question very often, can we teach propofol? Are we teaching propofol? And if yes or no, can you tell us what drugs you are using in your practice and what drugs you are teaching at the Vesper Institute?
So yes, understand that propofol by itself is really considered something to be given for general anesthesia. It's basically a barbiturate that is given to make them go to sleep. That's not really what we're trying to do with sedation dentistry. When we give midazolam, which is Versed, and fentanyl together, they work incredibly well. Your patients will basically be asleep. They will have no memory. They'll be extremely comfortable. But they're not going to have the situation where with general anesthesia, you can't wake them up.
Right.
This is a little tough to understand until you see it.
Mm-hmm.
We also use dexmedetomidine, Precedex, which is a wonderful, wonderful medication that helps control heart rate, blood pressure, those kinds of things. It's just a wonderful drug, helps patients not be quite as agitated with anesthesia of any kind. It's just beautiful. We can use Benadryl. We can use other medications like that help with some anxiety and some just being asleep a little bit, and then Zofran for nausea, and then on top of that we can use nitrous oxide. So the takeaway here is all of these, when you're talking about safety, Versed is reversible, fentanyl is reversible, nitrous oxide you can turn off. We titrate them to the level that the patient needs, and then we can also just almost immediately stop them. So it's really amazing.
That's great. That's great. So I appreciate answering those questions. I know that it's something that I get asked all the time about what we teach. And what is interesting about how you teach at Vesper Institute is you really not only just teach these medications, you teach a lot of medications that are out and available, but you teach what combination works best. You show them when they come into your office. And so it kind of puts the picture all together for our students. And so that's really amazing and great for them as well to learn. All right, next question. Here we go. So there are dentists on this call this evening that have been considering IV sedation, considering jumping into the pool and learning how to implement IV sedation into their practice. Now, Dr. Sayre, you go to work every day and your schedule is full of patients ready to have IV sedation and ready to have their dental work done. Probably is second nature to your team at this point because you've been doing it successfully and safely for such a long time. If there is a dentist on this call today and they are starting to ask themselves the question, do I have patients that want to be sedated? Do I have the right patients that I can safely implement IV sedation for? What would you say to them?
Well, so we hold this in our practice even a little bit different. We don't even, it's not asking. So many patients are like, would you like to have periodontal surgery, or would you like to do this or that? We just kind of consider the fact that if they're going to have a difficult procedure, here's your procedure and here's the sedation. Guess what? The only thing that the patients want to pay for is sedation. They really don't want to pay for the crown and this and that and the other. They're willing to go to sleep. And so you say to the person who's going to have a root canal, hey, we're going to do a root canal. It's going to take an hour and a half, and we'll use sedation for you. Don't say, would you like sedation? We're going to do sedation for you. And they go, yep, please. That's exactly what I want.
Sure.
Because, they just don't even know. I think it's Apple that says we're going to bring, you know, equipment or manufacturing or whatever to people that they don't really understand what they're going to get in advance.
Right.
And so this is the same thing. If you bring comfortable dentistry to everyone, if you just say, you know, we have a complicated case here, we suggest sedation, do you think that a patient's going to say no? And so with this, and I'll jump ahead on these slides, because you're doing sedation, your case average is bigger, your work is more, you get to do more, it's faster, it's more comfortable for the patient, they don't remember anything, and you get it all done. So it's really an amazing process that we in dentistry just don't quite get until we do it.
You know, Dr. Sayre, the other thing that I've learned about your practices and IV sedation in general is that it makes raving patients, right? So you have a patient base that is all of a sudden able to get dental work done comfortably. They are going to tell the world. They are going to tell their friends. They're going to tell their family. They're going to write the Google reviews you want, just because they finally had an amazing experience at the dentist. And so that's just another bonus of, you know, being able to fill your schedule with patients that really need the dental work done, but can do it comfortably in your office. And I've seen that. I've seen your Google reviews, and I've seen those patients refer families and friends to you because of that.
I have generations of patients now, because I'm quite honestly, I'm that old, but I have generations of patients where the mom had the wisdom teeth out, the dad had the wisdom teeth out, the son had the wisdom teeth out, and now they have kids, and they've got their kids are coming to us.
Right. It's amazing.
And you know, most dentists can say those kinds of things if they just do general dentistry and their patients only need that, but they're referring out the root canals, they're referring out,
Sure,
you know, the difficult situations, the extractions, and the things that they know they can do, but they don't have the sedation capacity. So yeah, we want to bring comfortable dentistry to everyone, and it's really important that we look at this. Almost, it's not quite 50%, but it is very high on the number of patients that refer us other patients during any given month. And we have, throughout our group, 700 new patients per month.
wow.
Yep.
Big number. That's a
Yep.
very big number. That's amazing. Amazing. Clay, we are ready for the next question. So Dr. Sayre, you teed this up a little bit ago, but you know, we recognize at Vesper Institute, we recognize that in dentistry that implementing something like IV sedation is an expensive investment. Whether it be signing up for the course, buying the new equipment for your practice. I personally have seen the benefits, right? I get to talk to students who have taken our course and say, hey, Joy, I've been able to do this with production or that with production. But how does IV sedation improve your production? How does it improve your profitability? And for somebody out there that's sort of on the fence about jumping to make the investment in the training, in the equipment, you know, how quickly are they going to be able to see an upside from that investment?
Well, if you actually do what we say, and you work at this and you understand it and you begin to create a sedation practice, everybody out there could, I don't know, probably double your practice in a year. I mean, really, truly. So I'm not going to get into the specifics of my practice, but we're talking about huge jumps, millions, not hundreds of thousands. We're talking about a lot of money. So beside that, let's look at the fact of a case value. When you go to the cardiologist and they say you need 4 bypasses, you need this, they don't say, you know, we're just going to do 1 today, and you know, you'll be good with that, and then we're going to make sure you're alive, and then we're going to go back in and do 2 more. And we in dentistry would learn, actually in school, to do a quadrant, you know, in the next quadrant.
Sure.
And this, even we've gotten to the point, dentistry, I'm not going to say we're fools, but almost like that, because even like in perio, your insurance says you can only do one quadrant at a time. You got to numb them up and do one quadrant. What? We do 4 quadrants of perio, scaling, root planing, all of that under sedation all day, every day. You have to. This is one mouth. We have to do quadrant dentistry and full mouth dentistry. You have an extraction here, a root canal here, a filling here, a crown here. You're going to do all of that at one time with sedation dentistry. Nobody's going to say anything. The patients are going to love it. It's the only way they're coming in. And so your case average is 2, 3, 4 times. You're going to do $6,000, $7,000, $8,000, $10,000 cases 2, 3 times a day. I can't even explain how big this can become for your practice. For those who are doing implants, you're going to get more referrals. They're going to be more comfortable. They're going to get it done much more quickly. For those of you who do oral surgery, you're going to do full mouth extractions. You're going to do wisdom teeth and all. It's just a game changer for your practice. I don't even know how to explain it any differently than that.
No, it's amazing. You know, the research is actually telling us that last year, the average dentist production in the US was $5,000. So what that tells us is that there's some that are below and some that are above that, right? But even just doubling that daily production so quickly after implementing IV sedation is a huge game changer for somebody's practice.
None of my docs do under $10,000 a day, and some of us do over $20,000
Right.
per day.
Per day.
Per day.
Amazing. Amazing. All right. Our next question is the one that I love to ask you because I know the answer. It's always a good question to ask when you know the answer. But kidding around, not kidding around, I'll say to Dr. Sayre, hey, could you go to the office tomorrow and practice dentistry without IV sedation? Could you ever go back to having a day where you don't practice IV sedation? So I'm going to let you tell everybody what you always tell me.
Well, number one, I wouldn't make it till noon.
I always say that. I'm like, how long would you last without that?
Yeah, I'm not really good with patience. Maybe some of you can tell that on this call. I just, I stick to what I know and what I do, and I'm an introvert, and that's okay. You can have extroverts, you can have everybody that wants to do sedation. That has nothing to do with it. But I want to get in there, be very specific, do great dentistry, make sure the patients are comfortable. And so I would not practice without. I went to one of my associates when Joy was kind of throwing some of these questions out a couple months ago. I went to one of my associates who's been with me for like 12 years. And I said, hey, would you do this again without sedation? She goes, hell no. He's just flat out, just no, I wouldn't do it. And all of my docs feel that way. So this is not just, it's a game changing life event for the practice, career, your life, your team. This brings the team together. If you're a nurse in an ICU, if you're a nurse that is doing orthopedics, you have a specific situation where you're really going to help these patients do this this particular treatment. And that's really how my staff feels across the entire 140 people. We're here to bring comfortable dentistry to everyone.
Yeah.
So they know this, and it creates this cohesive unit, which is different than, quite honestly, just sucking spit and doing hygiene. And because of that, your team is much happier. And so, it's an amazing transformation for your practice as you grow this. So the team, the patients, the dentists that are involved, everybody really, really likes sedation dentistry.
And you know what, Dr. Sayre, the one thing that I've noticed now that we have Vesper Institute and we're teaching IV sedation, it's never too late. It's never too late for a doctor to come to us and say, you know what, I've had enough. I don't want to practice dentistry that way anymore. I want to transform my life, my practice. Let's learn IV sedation. So we're getting, this isn't just the young dentist game. This is someone who, it's never too late. It's never too late to learn a new skill. It's never too late to incorporate this into someone's office. We're getting, practice owners and young associates alike that are thinking the same way that you are. Just how do I change the way I practice dentistry?
Well, so let me talk a little bit about that, because really, if you think about this, if this is the growth machine that you're missing, this is one of the best ways for older docs to get out of their practice and still maintain, treatment and those kinds of things. So you take a young doc and you get them up to snuff on some of these treatment modalities, and especially sedation, and they just take it off. And so you then can have more free time, be able to exit your practice or sell your practice to somebody who's doubling the practice. I mean, there's no better way to do this. You can't say, oh, come on, let's do some implants and the practice will grow dynamically. No, that's just not true. Every general dentist in here knows that's, oh, we're just going to go learn a little bit of periosurgery and have a much better practice. No, you're going to get X patients per year that need that procedure. I'm talking about all procedures. I'm talking about increasing your practice potential patients by 50%, because nobody in your area most likely is doing sedation.
Right.
If you're in a small town, you will become the king, period, end of statement. If you're in a large town, I just kind of realized this. If you're in Manhattan, 20,000 people work in one building. There may actually be 10 dentists in that building.
Sure.
That's 2,000 patients per dentist. That's a big practice right there. Let's say you're the only sedation practice in that building. Now you have 4,000 or 5,000 patients in one building in New York.
Right.
I mean,
Right.
I'm telling you, this works for so many different dentists that it's not even funny. And it just needs to be awake and out there, and it's not. And that's what we teach.
And it's funny to just piggyback on that for a second. I've had dentists come to me and say, well, Joy, I'm trying to decide between taking that implant course and taking your IV sedation course. And I say, well, at the end of the day, you need to do the IV sedation first, and then figure out what parts of dentistry you need to up your game, right? So I know it with your associates, like they're realizing now that their patients are comfortable, the patient's asleep, they can do more dentistry. Where do they need to work on? Is it implants? Is it extractions? Is it root canals, right? But the IV sedation is actually what you always consider to be the foundation or the groundwork to start.
Absolutely. You can be a super generalist, but you won't get the patients. I want to do tons of root canals. Well, if you offer sedation, we get referrals from endodontists. We get referrals from oral surgeons. We get referrals from the University of Cincinnati. We get referrals from everyone because we're one of the only people that do sedation. They can't fit them in. An oral surgeon says, oh, you could keep this tooth and you don't need to have it extracted. And they send them to us. We get endodontists. There's not one endodontist in Cincinnati or periodontist that does sedation.
Right.
It just aren't. I'm sorry. It's just, this is the nature of our industry. And we as dentists who want to grow our practices, this is number one. It's not endo, it's not perio, it's not implants, it is sedation.
Yep.
Guaranteed.
So at the bottom of the slide here, I've always asked to dig into, why you created Vesper Institute. I know you love to share your knowledge, your education, and your 40+ years of experience in the dental industry implementing IV sedation. But tell us a little bit more about why this is so important to you to now at this point of your career to be teaching IV sedation to other dentists.
Well, I think that everybody knows that it takes many years to become an overnight success. So I've been doing dentistry for a long time, and I've been incredibly successful at it. I woke up probably close to 10 years ago, and I said, well, I could treat one patient at a time, but that's just me. So how many people am I helping? And I thought, okay, I'm going to grow the practice. So I started these practices, and now I have 4 practices and 12 docs and all that. Okay, well, that's great, but this still isn't getting out to the dental public. We just aren't getting the information out there. So I'm on a fast train. I'm telling you right now, I'm on a fast train. Started Vesper Institute. I'm going to write a book. I'm going to write newsletters. I'm going to do everything I can to make sure that dentistry transforms. And that's what I'm going to say right now. But I need to help as many people as possible understand that we can really make patients more comfortable. We can have our teams happier, our staff excited, our doctors informed and excited. And this is a revamp of dentistry.
It's great. I love that. So Clay, I think we have another slide left.
You sure do. And pull it
Okay.
up. This is how, if folks have questions for you.
Hey, this is a slide that I don't have to talk about.
No. Well,
Yeah,
you
tell
will
us,
in a
sir.
second because there's questions coming in. So hold
Oh.
that thought.
Yeah.
You're not free to go
Yeah.
just hold
Small
on.
reprieve. So Joy, if folks have questions, whether, about pulling the curtain back further about how IV sedation is kind of centered in the practice in real life, or they have questions about Vesper Institute program, talk to us about kind of, about this slide, what you would love folks to do.
Sure. So if you have a question specifically about being a general dentist, maybe there's someone on this call that's an endodontist or a periodontist, but you're interested about IV sedation. You want to sort of ask Dr. Sayre some clinical questions, perhaps about the course or how he does IV sedation every day. That is his email. Feel free to reach out to him. I get students that ask very clinical questions. I always pass them over to Dr. Sayre, and he's happy to answer them and sort of understand a little bit more about why you're interested in IV sedation, and maybe he can help, answer those questions for you. For me, being the president of Vesper, I am running this amazing IV sedation program with our faculty, with Dr. Scott Sayre. We have 2 oral surgeons on faculty as well. They have written the best curriculum in the business. They came together as a really amazing, cohesive team to say, okay, we don't like the training that's out there. We're going to start from scratch and write this curriculum. We do online learning at home in the comfort of your own home. There is a weekend that you come to Cincinnati and you learn in person from our amazing faculty. And then you stay at a week that you pick that's convenient to your schedule with Dr. Sayre and his associates to learn how to implement IV sedation. You actually work on IV sedation patients. Every state has different requirements, but Dr. Sayre and his associates and staff teach you and teach your assistants that you bring with you. So any questions about the course itself, the requirements, anything like that, please reach out to me. Clay, is that QR code for our website, or is that a way to contact me as well?
Great question. That goes directly to your Calendly.
Okay, great.
So if you want to schedule a call, 5 minutes, 2 seconds, Joy's there.
Anything you want. That's
Yeah,
fine. I love talking to you. There's no dumb questions here. It is a big jump. And I want to help you sort of answer all those questions that you have about your practice, where IV sedation fits, what your state's requirements are, how can I handhold and help you through this process. Our next sedation course is December. We do have one in October, but it's already sold out. So the next one will be December. And then we've decided not to have a lot in the winter time because we knew people didn't really want to travel. So after that, the next one's not till March. So if this is something you're thinking of, we do have a couple spots open for December, not many. but definitely reach out to me sooner than later so we can get those questions answered. And I think we're going to pivot now. I think there's some questions in the chat.
Yep, actually, I don't think there's any in the chat, but I did
Okay.
promise. Someone emailed me today and said, I can't come. Please make sure you get this.
Perfect.
So when you send
Sure.
the recording, I can know.
Okay,
So the
great.
questions go like this. And I think there's one for each of you,
Oh,
Dr. Sayre and
okay.
Joy. Dr. Sayre, I'm going to give you yours first so you can just actually be done after that. Question was, liability insurance, ... significant change, question mark. So I think they're wondering if the change from being a non IV sedation centered practice to an IV sedation centered practice, how much in your experience does that affect your liability insurance?
Yeah, so that's a good question. And it's minimal. I don't know the exact number, but let's say that you're in Ohio. I use Cincinnati Insurance Company, and they're great. I think they're national for dentists, so you can look into them. But a general dentist, like $1,700, and with sedation, it's still like a couple hundred more. That's it. It's just not this big thing at all. And oral surgeons and other surgeons that go to the hospital, they have major liability insurance payments. It's just not true with general dentistry. Just doesn't happen.
Okay, I think that will suffice when we send the video over and the recording. And then Joy, this one's coming at you, so prepare
Okay.
yourself. And I know you get this on the daily, so not a big one. Credentialing. Talk to us about what folks you know what they need to know.
So I would tell you that dealing with state boards of dentistry would require something stronger than water in this cup. If you've Dr. Sayre's learning. If you have questions regarding your state itself, what we've done is we've actually applied to every state. We have answers whether we can or cannot teach you based on what the requirements are per state. Most of the states we are accredited. We are AGD, and so that helps a lot as well. We've put that accreditation through. But regarding the details of, do you need ACLS? How many patients do you need to treat? How long do you have to submit your application? Things like that. We help you through all of that, and we walk you through. When you reach out to me, one of the first questions I'm going to ask is, what state are you from? Let's talk about what the requirements are, because I want to make sure that first of all, you sign up for a class that you can get credit for. And second of all, we want to make sure that we can help you through the process to get all your paperwork together when you are ready to apply. Beautiful.
Beautifully said.
Yeah.
All right. I'm going to make sure we leave on this little note right there on the QR code. Again, my friends, if you have not yet put your name, first and last would be lovely, in the chat, and the state that you're in, that'd be great. Make sure we get your CEs at you. And otherwise, any last questions popping in the chat, but I think we are all wrapped up. Dr. Sayre, Joy, thank you. Great back and forth tonight. Really appreciate it. And everyone, thank you again for giving us your time tonight, and let us know if you have any questions.
Thank you so much. Look forward to hearing from you.
Bye.
Thank you. Be happy to help anybody.
Great. Thank you.
Night, Dr. Sayre. Night, Joy.